Good afternoon. My name is Colin Murray Kemp, and this is Thrive, the Future of Healthcare. Today we're going to be speaking with Dr. John McGough, internal medicine physician with MUSC Primary Care, practicing here in Charleston, South Carolina. Welcome, Dr. McGough.
Thank you for having me.
So tell me a little bit about yourself.
I work for MUSC here on James Island. I'm a board-certified internal medicine doctor that provides primary care.
Gotcha. So today we're going to talk a little bit about telehealth. So let's just set the stage for me. So what platform are you using to provide telehealth to patients? And I think a big concern or a question would be, is this platform simple and is it secure?
Sure. So the platform currently used for our delivery of telehealth is a service called doxy.me. And that service is a free service for patients, fairly user-friendly. So it can be used by any patient with an internet connection, whether that's using their smart device like a smartphone, a tablet, or perhaps a computer with a web camera. So with those types of tools, which I feel most Americans have, they are able to utilize telehealth services in that platform.
And the security, I'm sure, is a big, obviously it would be a question for people because your healthcare, cybersecurity is a big hot topic right now. Can patients be confident that their conversation with their doctor is secure?
And so that's one of the key challenges in employing telehealth, in that it must be HIPAA compliant, right? And so that's a federal mandate that all patient care be secure and private. And so when you're communicating with patients through the internet, you want to make sure that you're following federal law in that regard. So the doxy.me service is encrypted. So all communication through that video connection is encrypted and secure, unlike some of the technologies you may be familiar with on social media, that type of thing, very different.
Sure. So talk a little bit about you and your colleagues. How are y'all utilizing it? Have you become comfortable with it, and how have physicians in particular benefited from it?
So from the clinician side as well, at least for my experience and the experience of my partners in my practice, there was a learning curve initially, learning how to sign up and set your virtual waiting room. But that's a fairly easy process, and using the technology itself to connect with patients is fairly straightforward. You are assigned a virtual waiting room, and patients are able to get in that waiting room following their own set of instructions. And then you simply click a dot, a little dot on your screen that shows that the patient is there waiting for you. And by clicking that, you establish that connection.
So it's so easy that it's hard not to be receptive to it for the doctors.
It's very easy, at least from my standpoint. And when faced with the alternative, which was either a phone call or perhaps delaying care, delaying that appointment to a later date, it certainly became crucial. And as we learned with the service, now it's second nature.
That's a message that we in HealthLinks has really been trying to push to the communities. Don't delay your care. Even though you're quarantining, you still need to be proactive about your health care. So I want to move over a little bit to the telehealth kind of guidelines and the reimbursement side, and how Medicare has kind of changed with the reimbursement for telehealth. Can you talk a little bit about that? And then I want to get your opinion on whether or not you believe telehealth is a realistic revenue stream for doctors.
Sure. This was a huge shift. Prior to 2020, CMS would not reimburse to a large scale for any type of service a clinician would provide that did not include a face-to-face service. There were a few exceptions to that, but as a general rule, it required the patient to be assessed in person by the clinician. And in light or in response to the pandemic, CMS very thoughtfully, I believe, changed that in a way so that for any type of telehealth that involves real-time video and audio conferencing with patients, you may be reimbursed and billed for services quite similarly to your typical evaluation and management codes used in an outpatient setting. So for those familiar with codes like 99213 or 99214, which are traditional outpatient visit codes, those are reimbursed at similar rates for virtual care using telehealth as they would be for an in-person visit.
How long ago did that happen?
2020.
Yeah. So was it after after March?
It was after March of this year.
Was it pretty quickly into the pandemic?
It was pretty quickly, and that we jumped on that when things began to shift in the late spring or late winter, early spring.
Yep.
Knowing that again we knew it would not be feasible from a patient safety standpoint to postpone and delay, but also not feasible from a practice management standpoint in regard to revenue. So it was vital for us to be able to not only provide the patient care, but also to be able to bring revenue in.
And I know diabetes management, I saw in your bio, was something that you take pride in and have pursued. So take diabetes management. What percentage now, here we are in September, what percentage of your patients that you see regularly for diabetes management are you seeing via telehealth?
Well, that's a good question. And so, everything that we do depends on kind of the risk of the patient, right? And for some people that are very poorly controlled, telehealth may not be the best avenue. But for a lot of people that are either well controlled or near controlled, those people that are doing well but need that extra effort, need that extra guidance from a clinician, those are the people that really benefit from telehealth services. And so I would say a large percentage of those at this point I manage through telehealth. And we have made large advancements in technology for diabetic care outside of using video conferencing. For instance, real-time glucose monitoring, certain proprietary measurements that can be done without the traditional finger stick. And so we're able to use that type of technology along with patients reporting to us kind of symptoms, their glucose trends, et cetera, to be able to get a fairly good idea of how they're doing from a diabetic or glycemic standpoint without the need for them to be in the office directly. Sure. And in regard to COVID specifically, there's a lot of concern about the length of time that you are assessing the patient directly, face to face. And so we've integrated into our practice as kind of a complementary service in relation to a video visit, where the patient can have a curbside finger stick basically that allows us to get the testing they need with a drop of blood from their car with their video visit the next day. So a visit that before would have involved sitting in the waiting room, waiting for the doctor to come in, a traditional visit, exposure to 10, 15 other people, now involves a video visit with the clinician and a simple drop of blood from their car window. So minimizing exposures like that and a little creativity in figuring out how to get the information you need allows us to provide telehealth for a wide variety of situations.
So that naturally brings upon the question of what types of illnesses do you feel fit best for telehealth, and what types of things do you need to actually see the patient in person?
Sure. So again, it goes back to somewhat of the complexity of the issue that is being addressed. And so certain types of conditions, particularly mental health conditions, so depression follow-up, anxiety follow-up, those are ideal for telehealth in that a lot of what you're getting from a physical exam standpoint is just assessing the behavior and kind of speech patterns of a patient. And so that can all work very well using a telehealth type of encounter. Additionally, again, depending on some of the home resources and technology that patients are able to employ within the comfort of their own home, other things like hypertension or high blood pressure, certainly diabetic care, and a number of other chronic conditions can be managed in that way. For some things, certain respiratory issues, certain advanced heart issues, I do believe it still remains kind of standard of care, if you can, to assess those patients in person, if at all possible. But you'd be surprised at the types of physical exam findings that you can achieve through a video type of encounter. In one instance, I had a patient with advanced heart failure whose son was there in the home with him. The son was my hands, and he assessed for swelling in the lower extremity, swelling in the leg. So I kind of coached him via video, and we got an idea of how bad the gentleman's heart failure was without me actually being there. So with a little creativity, you can actually get a lot of physical exam without the patient directly being in the room with you.
So tell me a little bit about how creating patient-centered care with telehealth, how important that is and what it means.
So patient-centered care, involves a variety of things. And so first we want to address any of the specific health issues that a person may have, which may include chronic medical problems, but also is the opportunity to look into their preventive care, which may include preventive health items like bone density scans, mammograms, or certain vaccinations. But that also includes looking at the person on the individual level, and I think telehealth has really helped in that regard because, again, if you have a relationship with a patient and know them, there are things that you're able to identify through video that you may not pick up on a phone call. And I can say that I've had a number of visits using telehealth where upon discussion with the patient, that they may say one thing, but I do catch a look in their eye or a facial expression that indicates that they may not be meaning what they are saying. And
Sure.
that's been huge because, again, while we are responsible for maintaining these patients' health, we're also connecting with them on a personal level, and that type of technology allows us to continue to do that.
So tell me a little bit about the MUSC telehealth setup process in regards to home health and how that works.
So we're very fortunate that in addition to having telehealth, we have a very good home health service with MUSC embedded into our ACO. And so for any patient that needs home health services, we have that resource. But in addition to that, in light of the pandemic, we can use traditional home health services as well as rely upon the home health staff to utilize the video conferencing for the patient.
Mm-hmm.
So they are not only the healthcare provider or part of the healthcare team, but they're also using the technology themselves to help the patient connect with the clinician.
Sort of they're your kind of your eyes and your ears in the house while you're on the other side of the screen.
So they're basically performing, yes, their healthcare role and behind-the-scenes TV producer type role.
Sure, absolutely, and I can see that being really beneficial for for patients who aren't able to necessarily aren't technology sound or able to set it up by themselves, especially with the home health.
Sure, and it's been very helpful, especially for patients who may have recently gotten out of the hospital and might be a little too ill to work their phone or get their webcam angled properly, or maybe someone who is elderly and may not be familiar with the technology, and so having a healthcare professional there in the house with them, helping them use it, allows us to do our job more efficiently.
So what type of challenges or barriers can providers and patients expect when trying to initially utilize telehealth?
So I think for providers and patients alike, the first barrier I think would be our own fear, our own uncertainty. Again, this is something that really wasn't used on a widespread scale prior to this year, and so I think there is some uncertainty in that. For clinicians, I would say the main barrier is having a preconceived idea of what you can't do. And so we touched on that earlier. I think there are a lot of things that you can do. And so that's one big barrier for providers. Another barrier is the initial learning process. It does require a little bit of familiarity in navigating the online platform. And so being comfortable in that is a little bit of a barrier, but I would say a small one. Similarly, for patients, there is some barrier to being able to follow the directions. There's a web link that they are sent either via text or via email, so they should be familiar with some of those type of technologies. But beyond that, the barriers seem to be fairly low for patients. So as long as they have a reliable internet connection and feel comfortable either with email or text messaging, most of the barriers have been reduced from a patient standpoint.
So can you conjure up any sort of, I'm sure you're doing telehealth regularly, can you conjure up any sort of tricks of the trade or tactics that you've used to kind of make patients comfortable with utilizing telehealth?
I think it goes back to that connection you have with them that existed before they knew you in that format. And again, there's a big difference between seeing you on video than hearing your voice alone on the phone. And so I think that's one large way. Another way is just thanking the patient for taking the opportunity to join the 21st century with you in terms of healthcare. And it's kind of a jovial moment when you say, "Good morning, it's good to see you.
Yeah.
Never thought we'd be doing this like this before. Can you hear me okay? Can you see me okay?"
Yeah.
And just taking a moment to acknowledge that we're in a new world right now, and the more normal you make it for yourself, the more normal it is for patients.
Without seeing you in person, naturally, the patient will feel inclined to feel a sense of impersonal, but making it more personal with niceties and "Hello, how are you? Can you hear me?" I'm sure that puts them at ease.
And it does. And a lot of times you might hear about a person's home life when they're there in the clinic. They might reference a pet or a child or a spouse or a hobby that they have. And the interesting thing, one of the many interesting things with telehealth, is that sometimes you see that in real life in a way that you might not ever see if they're there in the office with you. So I've seen some beautiful handmade quilts on the wall, some rambunctious pets, some kids ready to go back to school, you name it. And so again, it's a way to get a more full picture of your patients. And having little conversations about that as you provide them medical care, again, helps it make it more normal for the patient.
Are there any particular success stories with telehealth that come to mind?
There are a lot.
Yeah.
And I could probably go on and on about that, but again, I'll go back to the gentleman with heart failure. Right. That was somewhat early in the course of the pandemic here in America, and he was truly at risk, and I was not going to have the man come to my clinic. I felt the risk was too great, and so we've kept him healthy at home with his family, and he's doing well. Again, with regular care through virtual care, through telehealth. And so I think that's a huge accomplishment, to take an octogenarian and assess him and give him advice that prevents him from being exposed to unnecessary risk while still maintaining his health status. So,
absolutely. One of the things that I want to circle back to that you were talking a little bit about the home health support, and maybe some of our audience, a lot of which are physicians, don't know about. Will you explain a little bit more about how that works?
Sure. So anytime that you would want home health services, whether that's home health nursing, physical therapy, etc., we have the ability to do that under traditional home health services, not just for people that are homebound. With the current pandemic, CMS has updated its guidelines to allow that variety of services to be done on a more widespread scale. again, due to some of these patients being at higher risk for complications due to COVID. So I think that's a great opportunity to use those healthcare professionals, that home health team, in ways in a little bit expanded than what we're traditionally used to. And so if you need lab work, if you need a wound assessed, if you need any type of physical therapy, you've got those services in addition to the video services that they are also able to provide. And so you can get a real-time update from a nurse via video who's there at the home with the patient, almost as if you were standing in a clinic with the nurse standing across from you. So if you need vital signs reassessed, or if you need other certain things related to physical exam or other objective data, you can communicate in real time with the team that's there on the ground.
Sure.
And so you're in your office and the patient is at home, but that process is streamlined using those services.
And any sort of additional thoughts or topics that we did not touch on in regards to how you've used telehealth over the last 6 months?
So we've used it in all sorts of ways. So we touched on kind of regular clinic visits, but again, going back to CMS in relation to annual wellness visits for all Medicare beneficiaries or for patients that have been recently discharged from the hospital that would benefit from transitional care management. Those type of patient encounters can also be done using telehealth under traditional E&M coding and reimbursement. And so that's very helpful for ACOs who are trying to ensure that they're meeting certain quality metrics for things like annual wellness visits or transitional care, because it does not require the patient to be, again, there in the office. You're able to do that, achieve those goals remotely. In addition to that, there are a lot of other measures that for ACOs as a large, that you can do remotely or at least discuss so that they've been addressed and you have a good plan going forward for them. So we've used it in that regard to ensure that patients stay up to date on some of those quality metrics that we're all being held accountable for by payers. And so the ability to stay up to date on that and not delay vaccination schedules, et cetera, has been a huge benefit through telehealth.
Thank you. Thanks for coming out and speaking with us.
Yeah,